In the week since a train derailed and caught fire in East Palestine, Ohio, sending plumes of black smoke and hazardous toxins into the air, residents who've returned to that area have reported a growing list of ailments, from rashes and nausea to difficulty breathing. In spite of those complaints, the EPA says air and water quality tests do not show dangerous levels of toxins in the air, telling the people of East Palestine that the air is safe to breathe and the water is safe to drink. But is it really? And has media across the country been giving this disaster the attention it deserves? To discuss it, I'm joined by Dr. Barr, a professor of environmental health at Emory University, and Mireille Bejjani. She is the co-executive director of Slingshot. That's a nonprofit that works with communities impacted by environmental threats. Good evening.
Good evening.
Hi, good evening.
So first, Dr. Barr, I want to talk about what a train derailment and, of course, this subsequent chemical spill, what kind of effect does it actually have on the environment for folks who can't quite understand the scope of this?
Right. Well, these large chemical spills are really dangerous to both the ecology and people. These are chemicals that are highly toxic, are carcinogens, can be teratogens, causing problems for fetuses in utero. And so there's justified concern in the area. And I think the kind of big disconnect from what the people are being told and what they're observing is causing a lot of uncertainty and problems with understanding if the government's being truthful or not with them.
And Mireille, when you have these conversations with communities that are affected by something like this, I mean, what is the number one thing? How do we keep ourselves safe? And can we trust officials when they tell us everything is safe?
Well, that's a great point you're touching on there, is that communities, especially environmental justice communities that have been impacted time and time again, are not, necessarily quick to trust when someone tells them something, because they have been impacted so many times. They have been potentially lied to by corporations. They've been misled. And so transparency and trust building are tremendously important, and building those relationships so that they can know that they are being cared for, and that the government and the company and all the players here are really carefully monitoring the situation, not just now, but next week and next month and next year and beyond that, because this situation isn't just a one and done deal. It's going to be potentially impacting those communities for decades to come.
And Dr. Barr, what would be happening on the ground right now? I know we're seeing officials, news cameras are catching folks, sticking mics in their faces kind of things, but what would be happening on the ground?
Well, right now, the officials are trying to contain and of the chemicals that are there, organized a controlled burning. They've been monitoring the chemicals themselves in air, particulate matter, and other noxious fumes that may be created as a result of the controlled burn. They're doing the right things, but I'm not sure it's quite enough. I mean, people can see that there are fish, for example, dying, or chickens dying in the area, and they're developing a lot of health outcomes or health symptoms that they think are related to these exposures. And so, as I mentioned before, there's just this disconnect in what they're seeing and what they're being told. And the potential hazards from these chemicals are high.
I know that I read a few articles that folks in Rhode Island, they felt like they smelled something or saw a fog in the air, and thought it was connected to this train derailment and chemical spill. The local EPA officials have said that they are not connected, but I imagine that feeling of disbelief, basically out of concern, it still lingers. And so, Mireille, how do you talk to communities about engaging their officials in a way that is meaningful, where they can get the answers they want?
It's an important thing that comes to play in so many different issues relating to environmental justice communities. And we had, Slingshot sent out an email to our list about this derailment, and we had several folks who responded and said, do you know of any, how can we track where the plume has gone? Do you know what the latest information is? And that's a big thing with a lot of environmental justice situations, is a lack of transparency, a lack of information being easily accessible to the public. And so I think that's where residents around here can ask their municipal officials, ask the local EPA stakeholders for that information in a way that they can easily understand and make decisions based off of as, you know, individual residents in communities around here. Having that information is one of the best ways to empower people to make decisions for their own health.
And, you know, Dr. Barr, as being a journalist for more than 20 years, I know that these stories are very difficult to explain and science can get lost on folks. Do you think that the media is explaining sort of the scope or the impact of this derailment to the folks that are in Ohio and basically on a national scale?
I think they're doing a good job explaining what they know and what they've been told. I think that the question is there something more lingering there that we haven't been told or we don't know about? I know people can go and just Google these chemicals and they can see all the harmful impacts that they have. And they can see what's going on around them. They can see these plumes of smoke and identify that there is some kind of toxic element that is, you know, they're breathing in or is getting into their water. I think that, you know, it's really imperative that we have a long-term follow-up of this. I mean, I think the government has a history of going in, trying to do a quick fix, and then I think that this is going to require some long-term follow-up to ensure that the levels are declining or are low enough to be safe for the community. And they need to follow up with any potential health outcomes in the community as well.
Mireille, how can the media rather be partners in this dissemination of information that obviously is a public need in a situation like this?
That's a really important part of making sure that information is accessible, is the outlets that people go to learn about things. I know I personally didn't hear about this story for a few days after it happened in, you know, big outlets. I was mostly seeing about it on Instagram and other social media platforms. And so I think media outlets really taking the time to share what's happening on the ground and share the firsthand perspectives of residents in East Palestine and surrounding communities. I think that's also something that we really connect with on a human level, is hearing how someone else is experiencing something and being able to relate to it from our own lens. And so that's a really powerful thing that outlets can provide, is sharing those firsthand experiences as this situation continues to unfold.
I imagine also keeping it in the news cycle is important as well, both for accountability and for folks who will continue to live with this.
Definitely. As Dr. Barr has mentioned, you know, this is not going to be done tomorrow or you know, even just a few months from now. And so keeping eyes on this, making sure that people are aware of what the latest situation is, what the latest levels are from monitoring, what the latest health outcomes are looking like. Accountability is a huge thing that is often lacking when it comes to impacts on frontline communities. And a big way to ensure accountability is to make sure that there's transparency, that there's information that's available so that people can follow up with decision makers who aren't holding up their end of the bargain.
Well, Dr. Barr, you know, we know that this particular situation happened in East Palestine, but will surrounding communities, even surrounding states, have to worry about this in years to come?
Possibly. I mean, the chemicals can leach into the ground, into soil, into groundwater that can travel over long distances. Right now, with this controlled burning, they have a plume of smoke that it can be observed in other places. My sister-in-law, for example, lives in Pittsburgh, and she said she can see some of the smoke from the burn. So yeah, communities have to be concerned if the chemicals are not adequately contained. Again, it's going to be something they need to continue to look at and assure the people that live there that the levels are low enough not to cause any harm, or to do something about it if they are higher.
And Mireille, what can folks do to make sure that they stay plugged in? We talked about making sure that they're reaching out to their public officials, but I imagine there are other channels that they can stay plugged into what is happening daily. I mean, you mentioned Instagram. It seems like that's where folks always go, but it can also be a place of disinformation, and that can be a concern as well.
I think a big thing here, as with so many other situations when something happens in our country, is to find trusted community organizations on the ground where this is happening to follow, to support. I am not currently directly aware of specific organizations, but I'm sure there are a number of groups in East Palestine and surrounding areas that are engaging in mutual aid to support residents there, that are engaging in sharing their perspective of what's happening. And I think they can be really powerful ways to get involved or to hear the latest or offer support, whether that's time or resources or amplifying what's happening. I think a good way to go about that is to find some trusted local groups of residents who are working to support each other and others through this situation.
And Dr. Barr, in the last few seconds that we have, I mean, what would be the lessons learned from this as you see going forward when we're talking about, you know, these dangerous chemicals on these trains going through communities?
Yeah, I mean, they have to be more careful about transporting these chemicals, whether they're by rail or by cars. I mean, these are very hazardous chemicals in their monomeric form, and they can cause a lot of problems. I think that, you know, we've had a lot of previous train derailments or chemical spills that should have given us information about how to better contain the chemicals and to ensure they're not getting spread out. So hopefully some of that information is being applied to this situation right now. But again, I just want to emphasize that long-term follow-up really is necessary to ensure that the community is safe on a long-term basis.
All right, we'll leave the conversation there. Dr. Dana Barr and Mireille Bejjani, thank you so much for your time.
Thank you.
Thank you.